Charles Tannock, why do you support an e-cigarette? Because many people say that it adds to glamour and charm of real cigarettes, and people who start with an e-cigarette very quickly, they would like to try to go for real.
Well, let me first say that I have an interest in this because I'm a retired medical doctor myself. I've never been a smoker. I used to work when I was a young doctor in a cancer ward. I've seen the terrible effects of smoking, terribly painful deaths from cancer, from bronchitis, from heart disease. Smoking is a very, very dangerous habit, and I will do everything I can to reduce its impact on public health in my country and throughout Europe. Personally, I believe that e-cigarettes are a reality. They are part of a package of what I call harm minimization. Nobody's ever been killed by an e-cigarette. They administer small doses of nicotine, but they don't have any carbon monoxide or any tar or any particulates. And I've had hundreds of emails from constituents who have told me that it's been a lifesaver to them to get them off real cigarettes. So it's not a gateway to enter smoking. It's a way of leaving smoking for something less dangerous and less harmful.
Sorry, but maybe it's for somebody, it's a game that can end in a real smoking.
I can't exclude the possibility there'll be some people who have an e-cigarette and then they try a real cigarette. But these people...
Why not turning them to pharmacies then?
These people can buy cigarettes anyway, with or without the e-cigarette. The e-cigarette coming off the market doesn't stop them being curious about a cigarette. There's thousands of young kids, particularly young girls, who are taking up smoking in my country every day. That's something which we need to try and reverse and stop as a trend. Anything which improves the chances of people stopping smoking or reducing the damage of smoking has to be a good thing. And I wasn't keen, and I'm a doctor, of medicalizing e-cigarettes, restricting them to the pharmaceutical companies.
Why not?
Because basically it would mean profit for the pharma companies and make them more expensive, drive the small manufacturers of e-cigarettes off the market, make them less accessible to the general public, and make them into a medical product. I don't see them as a medical product, I see them as a kind of help to come off cigarettes.
So e-cigarette is a real solution?
I'm not saying it's the only or real solution, it's just one of the solutions. I mean, there are lots of others. I mean, you can try hypnotherapy, you can try nicotine patches, nicotine chewing gum. It's part of the parcel of alternatives to try and kick the habit of smoking, which is very dangerous. And I really think that the Parliament was very sensible yesterday. We managed to get the Amendment 170 through. I was delighted. My group voted in favour of it, so did the Liberals, so did many in other groups. It was a majority. It may be reversed. Certainly my government in my country don't agree with my position, funnily enough. We voted against the position of the British government on this, who want to medicalise it. And I think there's a danger of over-medicalising things like habits, like smoking. If you want to medicalise e-cigarettes, why don't you medicalise cigarettes? Why, on that basis, why cigarettes? You can buy them over the counter. They kill you, and yet they're not a forbidden or a controlled drug. So we're being very illogical. Why are the e-cigarettes being medicalised and not the cigarettes themselves? So there's so much inconsistency in our public health policy here. But no, I think yesterday's package was good. We got a reasonable compromise. Things like slim cigarettes would be allowed because clearly there's little evidence that makes any difference. 65%.
Sorry, but they make difference because many women think that they are harmless or they cause less harm. That's the way they abuse them. So they add some glamour. So many women think that it's part of their glamorous image. That's the way they start using it because it's some legend about, I don't know, maybe it's a Hollywood legend, that thin cigarettes, they add some charm. So
all cigarettes. Some people add glamour. I've seen them. What about the one when you have a cigarette holder?
A cigar.
Cigarette holder, the long holder.
Yes, with long holder, yes, as well. But I mean that there was an idea that the cigarettes should look ugly. The product themselves, they shouldn't be thin, they shouldn't be glamorous, they should be thick and ugly. But it didn't go through.
No.
Why?
Because, as I said, I think there's a danger of being, over-regulating. I was perfectly happy with the compromise of 65% of the package of the cigarette being devoted to health warnings. I don't think there's much evidence that people don't know how dangerous cigarettes are. I mean, I've never met anybody who says, I don't know that cigarettes are bad for me. They smoke because for different reasons, social pressure, addiction to nicotine, something to do, you know, with their hands. Lots of reasons why people smoke or don't smoke. But we can try our best. You know, taxation has reached a level where if we raise the taxes anymore, we're going to get lots of smuggling of cigarettes from cheaper countries like Ukraine and Eastern Europe coming into Britain, into my country, and into the other European Union countries. No, I think there's only so far that you can go on this. There has to be public health campaigns, but actually just, you know, constantly, you know, raising the amount of space on the packet, saying how dangerous they are, isn't going to make much difference. At least we've got rid of the descriptors. You know, you can't say mild or moderate. Menthol is going to be phased out over the next 8 years. Mentholated cigarettes. The other one was the issue of 10 and 20. I discovered, you know, that you can't sell packets of 10 because the idea is that young people, it'd be cheaper, they might buy more easily buy a 10 than a 20. Well, that went through. You know, these things are very fine judgments, you know, whether it's going to make a big difference or not. I'm not entirely convinced the thin cigarettes makes a big difference, but you're a lady. If you tell me that makes you more likely to smoke, I will stand corrected on that one. But on the e-cigarettes, which I thought was the key vote, Amendment 170, I'm quite happy that that has been kept available on the market as a cheapish product, which will be widely available for those who want to stop smoking.
Thank you very much, Charles Tannock.
My pleasure.